Today I want to talk about international strategy for the elimination of tuberculosis in the world, tasks of the anti-tuberculosis service of the Russian Federation for 2019-2025. First of all, I want to remind you about the situation with tuberculosis in the world. Worldwide, tuberculosis is the 30th leading cause of death and the second leading infectious killer after COVID-19. Tuberculosis is caused by bacteria, such as Mycobacterium tuberculosis, and it most often affects the lungs. Tuberculosis is the leading cause of death of people with HIV and also a major contributor to antimicrobial resistance. Tuberculosis, like no other infection, claims the lives of the largest number of people in the world. It's about 2 billion people in the world are infected with tuberculosis. In 2020, 10 million people got sick with tuberculosis. The main cause of death in tuberculosis is associated with antimicrobial resistance and HIV infection. Russia is included in the list of 30 countries with a high burden of tuberculosis and multi-drug-resistant tuberculosis. The 17 Sustainable Development Goals adopted by world leaders in September 2015 set out a vision for a world free of poverty, hunger, disease, and want. Sustainable Development Goals, good health and well-being, calls on countries to ensure healthy lives and promote well-being for all at all ages. Among all of the goals, we clearly see point and the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases, and combat hepatitis, waterborne diseases, and other communicable diseases. AIDS, it is acute immunodeficiency syndrome. On this slide, you can see current global trend as a trend that was planned. The percentage of decline has not yet reached the goal set at the beginning of the journey. The global goals are optimization of the use of current and new diagnostic and treatment methods, strengthening of the health and social protection system. The next one is introduction of new technologies, vaccines, diagnostics, new drugs and treatment regimens, treatment of active tuberculosis and latent tuberculosis infection. Current liabilities, stepping up efforts to achieve the World Health Organization and Sustainable Development Goals for the elimination of tuberculosis. End tuberculosis by 2030. The actions and investments taken are significantly and insufficient to achieve the intended targets. On this slide, you can see the political commitment to ending the tuberculosis epidemic. In 2018, first on General Assembly high-level meeting on tuberculosis. Only by pooling our efforts, we will be able to respond to the threat, which is of course global. To achieve a fundamental change in the fight against this disease, essential of course new approaches to both at the national and the international level. The joint work of government agencies, public and professional organizations. An important success factor is the intensification of scientific research in the field of tuberculosis, with the development of effective diagnostic tools, vaccines, medicines, including those aimed at treating forms of tuberculosis resistant to exciting drugs. President of the Russian Federation, Vladimir Putin. Eliminate tuberculosis in an era of sustainable development, a multi-sectoral approach. Elements of the Moscow Declaration on the Elimination of Tuberculosis, high-level support and multi-sectoral approach, universal access to quality, human-centered tuberculosis prevention and treatment services, minimizing the risk of development and spreading drug resistance, sufficient and sustainable financing, promotion of scientific research and development, rapid introduction of new and more effective means of diagnosis, treatment, drug therapy, and prevention regimes, including vaccination. On this slide, you can see pictures from high-level meeting of the UN General Assembly, 26 September 2018. Elements of a political declaration on the outcome of the high-level meeting on tuberculosis. Overcoming the global multi-drug resistance tuberculosis public health crisis in line with efforts to overcome antimicrobial resistance. Comprehensive response to tuberculosis, HIV, non-communicable diseases, universal health coverage, health systems, global public health cooperation, epidemiological surveillance and adherence to World Health Organization, guidelines, research and innovation, annual mobilization of funds for scientific research, control report at the country level. Morbidity and mortality from tuberculosis in the Russian Federation. The incidence in 2020 decreased by more than 2 times, an annual decrease of 2.4 accounting points. Mortality 2005-2019 decreased by 3.9 times, annual mortality reduction of 1.3 accounting points. On this slide, you can see dynamics of mortality of the population of the Russian Federation from the disease caused by the human immunodeficiency virus per 100,000 people. Multi-drug resistant tuberculosis as a global problem public health. On this slide, you can see a map of the world showing the percentage of new cases of MDR tuberculosis. 558,000 new MDR tuberculosis cases in the world in the 2019. It can be seen that the largest percentage is countries of Central Asia, Russia, Ukraine, Belarus, and some others. Outcomes of a course of chemotherapy for extensively drug-resistant tuberculosis cases registered in 2020. Effective treatment in the world, Russia and European countries averages 34%. Target is ensuring a sustainable reduction in the incidence and mortality from tuberculosis in the period up to 2025 and beyond. Tasks: improvement of regulatory legal regulation, development and implementation of effective programs to prevent the spread of tuberculosis, ensuring high quality and effective diagnosis of tuberculosis, increasing the effectiveness of treatment with guaranteed drug supply, development of hospital replacing technologies, development and implementation of social support programs, improvement of the system of epidemiological surveillance, intensification of scientific research and introduction of advanced developments into practice, improvement of the material and technical base, sanitary and technical condition, and staffing, including penitentiary institutions. There are 3 important documents for improvement of regulatory legal regulation tuberculosis. Amendments to the legislation number 77 on warning spread of tuberculosis in Russian Federation. The second one, the procedure for conducting preventive examinations, and the third, draft procedure for dispensary observation. Prevention of the spread of tuberculosis among social and medical risk groups. All positions presented on this slide, like professional examinations and preventive treatment, interdepartmental interaction, raising public awareness, should improve the situation with tuberculosis in these risk groups to 2025 year. Diagnosis of tuberculosis, early detection of tuberculosis, and determination of drug resistance of the pathogen. The proportion of newly diagnosed patients in 2017 year is about 50%, and if we will use a new modern algorithm, a laboratory quality system, working network of reference laboratories, we can find that the proportion of newly diagnosed patients in 2025 year is about 68%. The same situation with the effectiveness of treatment of patients with tuberculosis and guaranteed drug supply. If we will complete drug supply, use shortened treatment regimes, implementing measures to increase commitment, increasing accessibility endoscopic surgical methods, improving rehabilitation treatment, palliative care system, we can increase the success treatment rate up to 70%. On this slide you can see a rubricator of clinical recommendations, Ministry of Health of Russia, and World Health Organization new documents to the treatment of MDR tuberculosis. On this slide you can see the classification of treatment group for multi-drug resistant tuberculosis. For example, Group A include all three medicines. Group B add one of both medicines, and Group C add to complete the regimen and when medicines from Groups A and B cannot be used. Development of hospital replacing technologies in the treatment of tuberculosis. Organization of a system for providing medical care to tuberculosis patients and an outpatient setting. Updating professional standards and training of medical workers. Social support for tuberculosis patients to improve adherence to treatment. Social support programs for patients and their families. Involvement of socially oriented public organizations. Accompaniment of tuberculosis patients upon release from the penitentiary system. Epidemiological surveillance. Tuberculosis epidemiological monitoring, modeling of the epidemiological situation. Statistical observation, Unified State Health Information System, monitoring organization, Federal Register of Patients with Tuberculosis. Training of medical workers in new information technologies. Current scientific research include basic research, preclinical studies, clinical researches, operational research. Scientific organizations of the Russian Federation, BRICS Research Network, Tuberculosis Research Cooperation Network in Eastern Europe and Central Asia, scientific funds, international organizations. Improving the material and technical base and staffing tuberculosis medical organizations. Infection control, infrastructure development, improvement of the material and technical base, training and recruitment. Expected results. Sustained decline of morbidity and mortality population from tuberculosis. Infrastructure improvement and refurbishment of tuberculosis organizations. Ensuring control over the spread of tuberculosis with MDR and XDR of the pathogen, reducing the absolute number of patients with tuberculosis with multi-drug resistance and extensively drug resistance of the pathogen. Ensuring control over the spread of tuberculosis among HIV-infected people, reducing the absolute number of people with tuberculosis HIV co-infection. improving the effectiveness of tuberculosis treatment. Thanks for your attention. Goodbye.